Hello, my name is Johan, and we're here to perform another part of the physical exam. This time will be HEENT. We will start with head, eyes, ears, and nose and throat. So this is Yvette. She's gonna be consenting for me to record this video while recording her on the physical exam to posteriorly publish the video as unlisted for grading. Yvette, do you agree for me to record this physical exam for posteriorly upload it?
Yes.
Thank you. So we're gonna start the HEENT exam. First of all, I'm gonna inspect the patient. We're looking for the whole contour of the head and the face. We're inspecting to see if there's any lesion, any abnormalities on the head. So now we're gonna palpate looking for thinning on the hair or any abnormalities like lesions, signs of trauma, or anything like that. Do you feel any pain in your head?
No.
Now we will move to the inspection of the face. Again, we're looking for any signs of discoloration, any signs of lesions. I don't see any papules or acne, anything like that. So everything seems to be with no alter pattern. Now we will move to actually inspect the eyes. Now we are we're inspecting the eyes for symmetry, and at the same time we're inspecting for the color of the sclera, looking for any signs of yellowish, which is going to be a alter pattern. So during the inspection, we're also looking for any ptosis or any abnormalities while the patient is blinking. In this case, everything seems to be normal. I don't see any deviation. There's no everything seems to be normal. Now we're gonna continue with the inspection. I have my hands clean. I'm gonna look for the conjunctiva of the eye. First, we assess the over. Can you look down, please? Thank you. Now we look downward. Can you look upward? Okay, the conjunctiva seems pink and moisture. There's no signs of discoloration, which is normal. Here we can see if the patient could probably have any anemia or problems with the liver, if the sclera or there will be any change of colors. Now we will inspect the eyes for gaze. So for the gaze, now you're gonna follow my finger. Don't move your head, just follow my finger with your eyes, okay? Look at the finger. Now we look for accommodation. There was accommodation successfully. There's no signs of nystagmus or any abnormality in the eye movement. Do you feel any pain?
No.
Now we're gonna do the Snellen chart test. For the purpose of this exam, this has to be performed within 6 feet. But for the space on the camera, we're gonna do it just. Can you stand up, please? Stand up right there, and I'm gonna be standing up right here. Okay, so you just we're gonna start with the normal result, which is gonna be 20/20. Try to see if she can read with both eyes first. Can you read the letters right here?
LTFF.
Okay, can you cover your right eye? Can you read this from this, starting from this point to the right?
LTFBH.
All right, we'll confirm that. Can you cover the other eye and read this in the opposite direction?
HBFTO.
Okay, what color is this?
All right.
And this one?
Green.
Okay, cover the other eye. What color is this?
Green.
And this one?
Right.
Okay, sit down again. Her vision is 20/20, which is normal, which is like any other regular she sees at 20 feet what other people sees at 20 feet. So the exam is normal. She also has, she's not colorblind. She can see the colors. Now I'm gonna move my hands and then you're gonna stare at me, right? Basically, I want you to tell me when you start seeing my fingers, okay?
Now?
Okay. Both sides?
Yes.
Okay, and that's a normal peripheral vision. Now we will proceed with the exams. We're gonna use the ophthalmoscope. So for the purpose of this exam, I haven't been into the immersion weekend yet. We have a similar tool right now that is gonna simulate the technique, but it doesn't really work. So we're gonna take the first we're gonna assess for the pupil reaction to light. So for that we have a pen light. Can you look at my forehead? All right. Right pupil reacts to light. Left pupil reacts to light. Now we're gonna look for the positive reaction to light. Can you look at my forehead, please? Now while illuminating the left pupil, the right pupil react to light, which means the exam is normal. There's a normal reaction to the test. Now we're gonna, with the ophthalmoscope, we're gonna look for the light reflex and look for in the fundus of the eye. So for that exam, we're gonna place ourselves perpendicular to the patient. With this hand, we're gonna accommodate the patient's head. And then with these fingers, we're gonna use these 3 fingers to separate the patient's face from our face so it doesn't become weird. And in case of the patient does any movement, she doesn't get injured by my proximity to her. Again, this is non-functional, but for the purpose of this exam, this is what we're gonna be using. Light is okay, but it doesn't really work. Okay, so I'm gonna approach to the patient. Can you look at straight to my back and fix your vision over there, okay? Now looking for the red reflex, she's positive, which means there's no tumor or any signs of malignancies in the eye. Normal is the reflection has to be seen. Now looking for the optic disc, it seems normal will be pink with no erythema around. There's no signs of hemorrhage. Now we're gonna inspect the left eye. We will switch hands for the ophthalmoscope, and we will use the same technique with the other hand. Can you look up on my shoulder, fix over there? And then we switch eyes. Again, 3 fingers. There's positive light reflex, and then there's no signs of papilla edema or hemorrhage. There's a pink color, normal. There's no erythema, and there's no inflammation. Now moving along, now we're gonna move down to the ears, and we're inspecting the ears for symmetry. Everything seems to be normal. There's symmetry in both ears. We inspect the external anatomy of the ears, looking for any lesions, any abnormal cerumen, or any abnormal discharge. There's nothing seen on any of the ears. Do you have any pain in your ears lately? Now we're gonna inspect the ear canal with the same tool. We have to switch pieces. And for the purpose of this examination, the lights work, but we're not gonna introduce this in the patient's ear canal. This is just gonna be demonstrating techniques. So we're gonna start with the right ear. So for this, we're gonna pull the patient's ear and try to introduce this very carefully and try to look for the tympanic membrane. The ear canal seems to be without lesions, without abscess, without discharge. There's a pink color on the contour, and the tympanic membrane is from a pearl gray color, which indicates it's normal. And the light reflex is on the right is at 5 p.m., which is normal. Now we're going to proceed to look at this on the left. We pull the ears to the back. And everything seems to be normal as well. There's no cerumen, no obstructions, no abscess, no discharge. And the tympanic membrane seems to be pearl, gray pearl. And the shining light is at 7 p.m. Now we're gonna take the chance and assess for the Weber and Rinne test. To start, I don't have a turning fork, but normally we will tap it against the palm of our hands, and it's gonna emit vibrations and a sound of 512 hertz. So we will place it in the patient's forehead, and then we will ask the patient to tell us if she hears the sound and for how long, and we will measure the sound and the time. So for the purpose of this exam, I'm gonna tap an imaginary turning fork, and I'm gonna place it on your forehead, and then you will tell me if you hear the sound.
Yes.
You hear the sound?
Yes.
That indicates that the test is normal. There's a normal bone conduction of the sound. Now for the Rinne test, we use the same turning fork, and we're gonna place it in the posterior part of the ear, in the bone prominence, and we're gonna ask the patient to state if she hears the sound, and then after that, we will immediately place it next to her ear. With both times will be measured. Air conduction should always be greater than bone conduction. In this case, we're gonna do it concurrently and ask the patient. So now I'm gonna do it in the close to your ear. So you're gonna tell me if you hear the sound.
Yes.
Let me know when you stop hearing the sound.
Stop.
Okay, checking on the time. Let me know if you hear the sound.
Yes.
Let me know when you stop hearing the sound.
No.
Okay, exam is normal, meaning air conduction is greater than bone conduction, and that's the Rinne and Weber test. Now we're gonna test for auditory problems. We're gonna whisper a word to the patient and several different words, and we're gonna ask the patient to state which words we whisper. Can you cover your left ear? Okay. You have to repeat the words I'm saying.
Green. Apple. Yellow.
Okay. Can you cover this part of the ear? Thank you. Now you have to repeat the words you hear.
1, 20, 2.
Okay, and that's normal. Moving along, now we will inspect for the nose position. The nose is center. There's no deviation. And we will ask the patient to tilt their head to the back and assess with the same tool, switching the pieces. Again, nothing will be introduced in the patient's nose for the purpose of this demonstration, because these tools are not actually functional, so we don't want to cause any harm on Yvette's face. So I'm just gonna demonstrate. So this small speculum will be used for the nose. Now, can you please tilt your head to the back? Thank you. So pretty much we're looking at the nose for any obstruction. We see that the nose is patent. There's no signs of perforation. There's no obstruction. The mucosa seems to be pink and moist. There's no signs of discharge on the right nerve. So now we're gonna inspect the left. Can you tilt your head to the back again, please? Again, we use the same technique. Again, there's no signs of obstructions. Mucosa is pink and moist. No signs of discharge or obstruction. There's no puncture. Now moving along, we're gonna continue with the mouth. In this case, we're gonna look for symmetry, any problems in the mouth and the lips. Looking for dryness or lesions. There's none. Now we're gonna ask the patient with a flashlight to open and a thumb depressor on hand. We're gonna ask the patient to say ah. Can you say ah, please? Stick your tongue out. So looking inside, I see the pallor. There's no lesion. There's no locus lesion. There's no problems. All the teeth are normal. There's no cavities. Tongue is centered without any. This will be used to depress, not for the purpose of this exam. We will depress the tongue and look for the uvula, and we will ask the patient to say, "Can you say ah?" The uvula doesn't go to any side center, which means there's no lesions, and everything seems to be normal. Normal salivation. There's no dryness on the mouth. The mucosa seems to be normal, pink as it should be. No bleeding in the gums or anything. Now, to continue with this exam, before continuing, now we're gonna start with the mild palpations, starting with the palpation of the temporal pulses, which are located. I'm sorry, my hands are a little cold. Okay, temporal pulse is +2, which is normal. It shouldn't be +3 or throbbing. And we're gonna use the stethoscopes to auscultate the temporal pulse, looking for bruits. There's no bruits. Now we're gonna locate the pulses on the carotid artery and inspecting the neck, also looking for any signs of abnormal vein distension. We try to locate the pulses. Pulses are +2, bilateral, symmetric. Now we're gonna auscultate both sides of the carotid, looking for any bruits. There's no bruit. Continuation with the exam, we also look for bruits in the position of the thyroid gland. Any indication of bruit will indicate any problems with the thyroid. So we're gonna auscultate the thyroid as well. Can you tilt your head to the back? Lean a little to the back, thank you. And there's no bruit auscultated. Continuing with the exam, now we're gonna palpate, looking for the lymph nodes. And we will start with the perioccipital lymph nodes that are in the back, Let me know if you feel any pain. So we go all the way in the occipital bone prominences, and we come back to the post-auricular lymph nodes. We come back to the pre-auricular lymph nodes. We go back to the cervical nodes, the submandibular lymph nodes, and the mental lymph nodes. Coming down to all the cervical posterior lymph nodes. You locate the sternocleidomastoid muscle, and they are posteriorly and anteriorly. And then we move to the supraclavicular lymph nodes. There's no signs of lymphadenopathy palpated. Now to continue with this, now we're gonna try to feel the thyroid gland and the trachea, and we do this from the back. We give the patient a little cup of water, and we ask the patient to swallow water. So I'm gonna go to the back, and I'm gonna disappear from the camera for just 5 seconds. My hands are here. We're simulating that you have a cup of water right here. Can you swallow water, please? And I felt there's no deviation. I felt the thyroid, there's no masses, no abnormal polyps, and there's no inflammation, no signs of goiter. Do you feel any pain during the swallow? And now we're gonna test, I'm gonna ask you to raise your shoulders, and I'm gonna press down, and you're gonna tell me if you feel any pain in your neck. Lift your shoulders. Any pain?
No.
Okay. Now you're gonna try to turn your face away against my hand. Any pain?
No.
Okay. Let's do the same here. Any pain?
No.
With this, we're testing if there's any problems in the muscles surrounding the neck, the sternocleidomastoid, and the surrounding tissue. Now we're gonna palpate the sinuses. The sinuses are two places. We're gonna start with the frontal sinuses that are located above the eyebrows. You feel any pain?
No.
Okay, we will move down to the maxillary sinuses. Any pain?
No.
All right. Any abnormalities will indicate any problems of inflammation, like with the sinusitis, something similar like that. Do you have any questions for me at all?
No.
Okay, and that conclude the HEENT exam. Thank you for watching.